B. You hear a nurse and a senior nurse discussing a patient. Now read the question.
Joe is doing much better today.
Well, that's good to hear.
Yeah, he's just done his 9 o'clock exercise session. He's got normal movement in his right shoulder now. He performed both rotation and flexion exercises very well.
What about the hip exercises?
He can do the abduction and the extension exercises, but he still has a lot of pain in his right hip. And as for exercises for the left shoulder, he can only do the shoulder flexion to 100 degrees, and he can't do the shoulder extension exercises at all for the moment. I'm just writing up the flow sheet now. Do you need any other information?
Listening Part B. You hear an optometrist talking about amblyopia to parents and teachers at a kindergarten. Now read the question.
I was asked here today to provide important information regarding amblyopia in children. Amblyopia is a condition in which the nerve pathway from an affected eye to the brain is not properly developed during childhood. It is the most common visual impairment among children and affects up to 3% of the young population. However, because only one eye is usually affected and the other eye does the work of both, many parents are unaware of the problem. Fortunately, it can be easily detected with a thorough eye examination, and the earlier the condition is detected, the easier it is to treat. Treatment depends on the particular cause of amblyopia. However, most commonly eyeglasses, prisms, and eye drops or patches are used to blur the vision of the normal eye and force the brain to recognise the image from the eye with amblyopia. Now, the government is offering free eye tests at our Centre for Medical Care Holders, so I urge you to take advantage of this offer.
Listening Part B. You hear a nursing lecture talking about side effects to a group of student nurses. Now, read the question.
Today, we are talking about side effects. We'll look at the most common drugs first. As you know, some patients suffer side effects and others don't. And not all patients suffer the same side effects either. Let's consider ibuprofen, for example, a very common pain medication. Some people may suffer dizziness, and others might feel nauseous. It's also possible to have diarrhea, vomiting, even headaches with this type of pain medication. Injecting drugs intravenously may cause swelling at the injection site for some patients. Stomach aches are a side effect of some anti-allergy drugs, as well as loss of appetite and constipation. Patients who take Valium may experience drowsiness, while others may get a rash. Tremors are another side effect of this drug.
Listening Part B. You hear a senior registrar talking about cholesterol to a group of junior doctors. Now read the question.
The average total cholesterol level in the UK is 5.5 millimole per litre for men and 5.6 millimole per litre for women, which is above a normal level. So does that mean that most people need to take anti-cholesterol drugs? In recent years, we've come to realise that to decide whether an individual's cholesterol levels are dangerous, these levels need to be considered in the light of the person's overall risk of heart disease. This overall risk is determined by a combination of factors, including age, gender, family history of heart disease, and whether someone smokes, is overweight, has high blood pressure or diabetes. The higher the risk of heart disease, for example, a male smoker with high blood pressure and diabetes, then the greater the need to get cholesterol levels down.
Listening Part B. You hear an agency nurse checking his schedule with an employee at the agency. Now read the question.
Hi Karen, it's Tyler Brewster. Are you able to give me my schedule for this week?
Sure. Is the afternoon shift okay for you?
I have exams in the morning, so the afternoon shifts are perfect, yeah.
Okay. So you start on Tuesday at 16:45 and finish at 2300. On Wednesday, you start at 15:30 and finish at 22:15. It's the same on Thursday.
Oh, that's good for me.
Are you free on Friday? I need a staff nurse for St. Peter's Care Home in Hillsworth.
I'm not free on Friday, no. But Saturday? I can work on Saturday if you need me.
Saturday. Can you do a shift at the Amazon Hospital?
No problem. What time's the shift? Listening Part B. You hear a conversation between a senior nurse and a student nurse. Now, read the question.
If you give an injection, always throw away the needle in the sharps box here.
What about the cap?
Never recap the needle, just drop it in the box.
Why?
So you don't injure yourself with the needle, and we have a special place where we throw away the sharps boxes. If you want to throw away other material like gauze or surgical tape, never put them in the sharps box. Sharps boxes are very expensive, and we have a special waste room where we throw them away.
Okay, I understand.
And if you take blood, always use disposable gloves. And in the OR, if you pass sharps like needles and knives, never use your hands. Always use a tray.